Welcome, everybody, to tonight's webinar, our webinar that allows us all to get a handle on where we're up to, the state of the art in arts and health policy in Australia. And we are so fortunate to have the very people who know, perhaps better than anybody else, how to answer that question. So before we begin, I would like to acknowledge that we are all joining this webinar from unceded Aboriginal land. It's land whose customs and traditions inspire us to understand and connect with the power of culture as central to the way we live our lives and the way we understand our well-being. We pay respects to elders past, present, and emerging. And I know as a sector, we try all the time to step up to the pathways that have been set down in terms of custodianship and care as models and inspirations before us. So welcome to this webinar. I think many people know me, but I am Claire Hooker. I work at the University of Sydney in the Sydney School of Public Health, where my main concern is research that supports the importance of arts, creativity, and culture in health and well-being. And I'm here as the president of the Arts Health Network New South Wales ACT, and I'm joined here by Professor Katherine Boydell, do you want to wave, Katherine, so that we can see you and you can jump onto everybody's screens? Katherine is a leading international presence in research on arts and health, the editor of the journal Arts in Health, and a professor at the Black Dog Institute, where she has an extraordinary diverse body of work that I strongly encourage everybody to go and read about. Katherine's scholarship has been a guiding light in our field for a very long period of time. If you want to know more about either myself or Katherine, we both have profiles on our institutional pages. For tonight's webinar, I'd also like to acknowledge the various institutions that have made this evening possible. So the first of those is the Arts Health Network New South Wales ACT. The QR code will take you to the page that you see there, and you can see the button that you can click to become a member, which is very simple. It simply involves emailing us at our Gmail address, and you'll find the instructions online. The Arts Health Network is a network that brings together advocates, scholars, specialty practitioners, patients, beneficiaries, interested members of the public, in view of our mission to connect, advocate, share, and celebrate the research and activities that support connectivity to culture and arts for health and well-being. The producers of tonight's webinar are the wonderful Create Centre at the University of Sydney. The Create Centre has an extraordinary array of research interests and projects, all inspired by this mission for understanding creativity and the arts in transforming education, health, and well-being. So this QR code will take you to the Create Centre homepage, where you can read about the extraordinary list of our projects, our research projects, and it will also let you know about upcoming events and webinars, particularly professional development programming and capacity building in arts and education, and where arts and education intersect with health and well-being. And this QR code, which will come up now, will take you to the Create Centre YouTube video, YouTube channel, where recordings from past webinars appear, and you'll find the recording of tonight's webinar up there in due course. And the third partner that is producing tonight's webinar is the new node at the Sydney Policy Lab. It's titled Harnessing the Arts for Health and Care, which we like to shorten to just calling the Hearts of Care. Node co-lead Professor Brendan McCormack, I notice, is here joining us as part of this webinar. Tonight's webinar is one of the first activities of this new node, whose aim is to support capacity development in arts and health policy around Australia. And I'd just like to mention that this is, in a way, a stepping stone to a bigger event, a full day event on August 27, where capacity building will be undertaken. So that is more than enough from me. I know everyone is here to listen to our panel. So I'm really delighted at this point in time to simply introduce our first panelist. Our first panelist is Brigitte Uren, and I hope I'm pronouncing your surname correctly, Brigitte. You can correct me if you would like to. Brigitte is the Program Director, Arts in New South Wales Health Infrastructure. And she's had a distinguished career leading dynamic cultural organisations in metropolitan and regional New South Wales, including the, to me at least, and to many, many people, much loved Maitland Art Gallery, delivering outstanding business outcomes through award-winning engagement activities and enviable entrepreneurial partnerships. She joined New South Wales Health Infrastructure in 2019, tasked to catalyse capital funding to enable the 2017 New South Wales Health and the Arts Framework. So that document is one of the key policy milestones that's occurred in our sector, and Brigitte has been carrying its work forward really for such a long time now. The Arts and Health Infrastructure Program with commissioned projects has won several accolades since, locally, nationally, and globally. Brigitte established and has since chaired the Australasian Health Infrastructure Alliance Arts Subgroup since 2020, influencing the recognition of arts in all future health redevelopments, and she's recently led the refresh of the New South Wales framework with a strategic vision in place to 2032. She's driven by the role of the arts, artists, their ideas and practice as a catalyst for bringing people together and for strengthening communities. Thank you so much for joining us, Brigitte. You've been an inspiration and a role model for me for these many years now, and we're delighted to hear what you have to say.
Thank you so much for that warm welcome. Following Claire's very generous acknowledgement of country earlier today, I also would like to pay my respects to elders past, present and emerging. Today I am on Wonnarua lands in the Hunter Valley region of New South Wales, and certainly extend that acknowledgement to other Aboriginal and Torres Strait Islander peoples joining us today. It's a really great privilege for us at Health Infrastructure to work across so many different language groups in New South Wales. And certainly so much of this work that I'll share with you tonight has really been led and informed by what those communities of saltwater, freshwater people have taught us, and so generously. I'm very deeply appreciative for their counsel over the last several years as I've navigated this space. The current state of arts in health policy at New South Wales, and I'll try to make this, somewhat dry topic as exciting as possible. I'm looking at this in the first instance in a New South Wales health arts piece, and then how that broadens out. So as Claire mentioned before, we had a first policy that was very heavily driven by Minister Skinner in previous governments in 2017, and that was then very much supported by subsequent health secretaries, and which led to the launch of the New South Wales Health and the Arts Framework update last year. So that's our current starting point. but it's very much embedded in so many other strategies, policies, and frameworks. In the first instance, the strategic alignment with the future health strategy at New South Wales Health, Aboriginal Health Plan is very important to this body of work, and so to the Regional Health Strategic Plan. Only a couple of weeks ago, the New South Wales Health Research and Innovation Strategy was also launched. And whilst the New South Wales Health and the Arts Framework, technically came before it, there's a lot of conversation, collaboration across so many different departments at New South Wales Health, and very much part and parcel of how integrated governance really supports the realisation of this work. More broadly across Australasia, as Claire mentioned, I'm part of the Australasian Health Infrastructure Alliance Arts subgroup and established that in 2020. The significance of that, I think, is really important as part of this conversation, because every state and jurisdiction across Australia and New Zealand have representatives on this group, and does feed into a more significant body of work, which is the Australasian Health Facility Guidelines. Every single hospital in in Australia and New Zealand is built to the Australasian Health Facility Guidelines. When I first started, I was really interested to know, where does arts fit in those guidelines, and was probably not so surprised, but still very shocked that arts was reflected in that as a hook on a wall in a particular clinical unit. And so if it is not built into those documents, then arts is only really determined by personalities, and if it's a nice to have or not. So the work that we've done in shaping the Australasian Health Facility Guidelines, Arts Infrastructure Framework, and then continually with so many different health planning units and guidelines, everything from residential aged care through to renal, paediatric units, emergency, mental health, etc. There's a huge role that we've had to play in ensuring that arts is considered in those health planning units into the future. They feed very much from evidence that we are drawing largely internationally. You heard Claire Hooker offer before Katherine Boydell's exceptional work that she's been doing in this space, and we rely very heavily on the evidence that's coming locally, nationally, and internationally to shape the guidelines in that AHIA group. So they're very much part and parcel of each other. We couldn't do one without the other. The arts framework, so coming back to New South Wales most specifically, that framework that we launched last year, we really built around three key objectives: integrated governance, creative health programs, and impact. The research, evaluation, and development, I think we'll hear a lot in the conversation tonight, but very much it's incredibly important, the sustainability of this sector built on evidence that's undertaken. The enablers as part of this work also, and I'm looking at, at a lens from New South Wales Health again only, very much cultural partnerships, and I'll share some of that with you in a moment, interdepartmental collaboration, and things like, schools, Create New South Wales, etc. Funding models and how we can look at different ways to make this work viable, sustainable, and impactful, and certainly in a very, very tight and under pressure government status. How do we add value to healthcare service? And so that impact and innovation again becomes paramount to the conversation. As an example of cultural partnership, this image that you see here is with Danielle Galotta, who's a huge advocate in this space. She's at the Art Gallery of New South Wales, and we worked on a partnership across the Murrumbidgee Local Health District at 3 residential aged care services with the Art Gallery of New South Wales and ourselves as part of the redevelopment of those 3 services. And it had a massive impact in supporting reduced psychotropic usage, stimulating brain function, for example, and boosting morale in really challenging conditions like COVID lockdowns, when you weren't able to receive families and carers outside of that service. One thing that was really important about that program is when we went around to those services to see what they needed, both they and local schools said, we want to participate and collaborate more, but we're really only showing up for the end of school choir, Christmas carol, or we might be doing very meaningful activities, but don't have an exchange environment with them. So with the Art Gallery of New South Wales support, we developed a conversation program that was intended not just for residents to residents or residents to staff, but also how we could bring community in as part of those experiences. And we were so delighted. Culcan Public School is one example. They shifted their art classes when they might have gone to the service once or twice a year. They ended up then walking up to that service and undertaking their art classes there every fortnight. And so that exchange with residents and young people became really important, not just for clinical care in that space, of course, but ensuring those residents had really great access to community wellbeing and being part of community. Interdepartmental partnerships I could give a whole lecture on in and of itself. I'm really proud of these and the work that our teams have created here. They really are about patient safety and health literacy in the first instance, but the way in which we collaborate with other departments like the Department of Education and TAFE distance education, for example, the opportunities that we're seeing here are far greater than just the redevelopment opportunities to collaborate and create a friendlier health environment. They're really having a very significant social wellbeing impact. And as I'll share with you in a moment, the potential future workforce development is a very exciting way in which that we can support not just the short term, but the long-term impacts of arts in health. Funding models and future state, which I'm sure is where everyone would like to linger for much longer tonight, and looking forward to that conversation to follow. And this is not a prescriptive list either by any stretch of the imagination, but we're constantly looking at different ways in which we can add value to programs, limit the operational impost of these on the health service, but also ensure that we're unlocking potential for innovation and not just health impact, but community and population wellbeing. There's certainly opportunities in New South Wales with events and 24-hour economy stimulus. These health and academic precincts that we are working in have a 24-hour workforce, and that workforce would like to enjoy things like a drink when they finish their shift at 6 a.m, for example. How can we unlock the potential of arts in these health and academic precincts to create a more stimulating environment for those workers coming in and out of those enormous precincts? And some of them, as example, like RPA, they'll receive more than 40,000 people per week. They're huge statistics and opportunities as audiences for the arts to harness. And we're very excited about the future potential of working with arts in these significant precincts. Philanthropy, like medical research, foundations or universities, of course, are an opportunity here, and with someone to drive it, I think could be sensational. But one project I wanted to bring to your attention tonight is adaptive reuse of space. So we are working in health infrastructure, obviously building and refurbishing new hospitals. But another example of that is those services and older buildings that are no longer fit for clinical impact, but they might have a huge opportunity for artists and studios. So in the slides I've offered to you before, they're really about where artists can come into clinical spaces and work with patients or clinicians to support those experiences, either on ward or across community. The opportunity with adaptive reuse is so exciting because that's really about where the artist can take their practice out and doesn't necessarily need to be anchored to clinical models of care. So this is an example from the Randwick Creative Ward, designed for Vivid's New Normal exhibition, and has since been shown at Rocket Gallery, London's Meanwhile exhibition. And this is really looking at an opportunity at no longer clinical used wards at Prince of Wales Hospital campus, and looking at converting 40 inpatient bedrooms across 2 clinical wards on 1 floor and creating a very dynamic space for artists to be able to work. We all know that artists are very compromised when it comes to studio real estate in major metro centres, and we see that there's a really exciting opportunity with our health and academic precincts, 24-hour economy opportunities, with creative communities, policies like Create New South Wales has just launched, and how we can work together to unlock this kind of real estate to shape the opportunities for artists to work in and outside of clinical care environments. I'm sure I'm going way over, Claire. You're going to have to give me a buzzer to say tune off, but I promise these are my last 2 slides. Maxwell Hospital.
Maybe 1 more minute, Brigitte.
Thanks. Maxwell Hospital here is a really great example of the impact, and when we research the work that's been put into it, Aboriginal workforce attraction has increased 300% as a result of this arts investment. Nurse and admin trainees identifying as Aboriginal have had a 500% increase. And you can see the ripple effect then with 28-day returns and workplace conditions. And when those staff were being interviewed and asked why did they want to work at the hospital, 100% of those applicants said because we were part of the arts program during that weaving project. And they were just so enamored with how health spaces could be and work, and inspire them to want to work in that service. So we see huge opportunity for those interdepartmental collaborations to really inform the future of healthcare. I won't share the video, I'll put it in the link, and thanks everyone for your time tonight.
I think that, thank you, Brigitte. I think that this whole night we will all want everything to go for longer, every speaker, every conversation. I'm so pleased to have that insight from what you can see from your perspective. Well, let's go from state to federal. And welcome the Honourable Susan Templeman, member for Macquarie and special envoy for the arts. And I feel like the word special is so authentic here because it's been a concern of Susan's from the beginning and for such a very long time. Susan, I hope you don't mind me referring to you as Susan because I think everybody does. And so Susan was a journalist and media trainer who began her career as the youngest permanent journalist in the Canberra Press Gallery. So you've had an eye on policy from a particular perspective for a very long time now. Susan's journalistic career involved working overseas for 2UE and Austereo, becoming the news editor for LBC, moving back to Australia to work as a media relations officer for Telecom, remember Telecom? And then becoming one of Australia's most successful media trainers. After that, Susan turned her attention to politics. It's a courageous move. Most of us would not want to take on that job. So thank you for doing it and taking it on. And she ran for office a couple of times and then was elected on a hair's breadth, nail-biting margin in the seat of Macquarie in 2016, which she has held very strongly ever since then. Susan is extremely well known for her tireless advocacy, both for improved mental health services and for the arts. Thank you for joining us, Susan, and for telling us where Revive is going to take us next.
Thank you. And I am going to put a timer on so I can at least keep track. There is so much to say on this. And first of all, I want to acknowledge that I'm coming from Darragan Gundungurra land here in the Blue Mountains in part of my electorate. And I pay my respects to elders past and present and acknowledge all the Aboriginal and Torres Strait Islander people who work in the arts and tell their stories and who are part of tonight's forum. And I want to thank people for the work that you're doing. I mean, like me, you are here because you actually want to change things, and we're choosing different ways to do it. But wanting to see better mental health services for young people was a real driver for me. And the arts is another real driver for me. And this really is a collision of both those things. And I thought I'd start with just a couple of personal things that I use to explain to my colleagues about how important the arts is when we're talking health. That the arts is not a little box that sits off to the side and, you know, we do it when we've got time, but it is something that can change our lives. And the first story I'm going to tell is one of my own. So in 2013, my house burnt down here in the Blue Mountains. I'm in the rebuild, along with 200 other families who lost their homes in a big bushfire. And it's a hard thing to go through, the trauma of going through it. You just wouldn't wish it on anybody. But one of the ways I dealt with it was with music. And I'd find myself travelling up the Great Western Highway, for those who know the Blue Mountains, and I'd have to drive past my turn-off to my block of land at that stage in Winmalee, and I'd have to drive up the road further to Hazelbrook. And it actually used to kind of kick me in the guts as I drove past my turn-off. So what I'd do, I mean, I had the benefit of having a little red Mazda MX-5, so I'd pull over, put the roof down. I would put music on in my, it was CDs in those days, CDs on in the car, and I would literally sing my way up the Great Western Highway, knowing that most other people had their windows up and would not be hearing my singing. And I chose music that was just what I could put in, but Queen was a favourite and Meatloaf was a favourite because I wanted something loud and big. And by the time I got up to Hazelbrook, I was often singing along with Queen, and the song that would get me in my driveway was Don't Stop Me Now. And I've got to tell you the difference that made to my headspace between how I was feeling 15, 20 minutes down the road at the turn-off to when I drove into the driveway of my temporary home was amazing. And it reminded me of how powerful music is, and not just the art of listening, but actually the physical stuff of singing. And so it doesn't surprise me that in aged care, we know that well-being is enhanced for some people by being part of singing songs that they've known all their lives, and in dementia wards that people are still able to access that part of their memory sometimes. It doesn't surprised me that one of the ways local teachers sought to help kids deal with the trauma they'd been through in those Winmalee bushfires was through drama. And there was the most extraordinary play put together by Winmalee High School that tapped into people's experiences. They interviewed people and they used drama to tell the story. So all of this, for me, is part of why we know that art is so important for well-being, for mental health. But I've got to tell you, there's not an exercise class that doesn't use music to motivate people. So I see benefits going across it. So that's a sort of thinking that we bring into the policy area. And Revive, the National Cultural Policy, recognises that arts and culture contribute to a range of outcomes, including complementing clinical health stuff and mental health supports. So in terms of how we make that happen, I think it's interesting seeing in New South Wales the whole having artists operating in non-clinical domains, and we recognise that gives encourages communities who might otherwise not seek help, be part of an arts community and connect into it. We know for young people, when you ask them about arts, the one of the recent surveys showed that music and the arts were identified in the top 5 positive influences on mental health, and one of the top 5 activities young people were most likely to engage in. So in the past, Creative Australia, the unit where peers are determining how funding is spent, with some broad policy parameters. They've invested in projects like the Big Anxiety, a festival that challenges artists, scientists and communities to reframe the discussion around health and wellbeing. But since 2022, they've been conducting research on arts and health practice so that we know that we have an evidence base for it. And it was great to have Creative Australia in late 2023 launching the Creating Wellbeing and Creative Solutions reports, which Claire and Katherine know only too well. And I know Brigitte contributed to this as well. So, the very people we're here talking with. Now, I can't give you commitments on the concrete recommendations that were in there, but that helps us have a pathway forward. Right now, there's $4.2 million being invested in 2 pilot initiatives which support access to music and art therapy programs, and they're collecting really valuable data about the impacts, the demand and the impacts. One's through the Department of Health, Disability and Ageing, and that is a $3.3 million program to test the impact and demand for arts and music therapy. And the other one is through the Office of the Arts, and that's a $1 million grant over 3 years to Nordoff Robbins Music Therapy, just down the road from me in Penrith. And that's to increase access and expand music therapy and community music programs to more participants. And that includes a program for veterans. And I had one gentleman from that program tell me that attending that program was the only thing that got him out the door during the week without his wife. It was the only time he left the house on his own, and he just had seen it as being transformational for his life and his wife's life. So in addition to that, some of the primary health networks are funding other creative arts and music therapies through the Commonwealth Psychosocial Support Program and mental health services. So there's a range of ways it's done, and collecting the evidence is crucial. And that's why both the Revive Creative Therapies pilots are collecting data and evaluating them. And I think we'll talk more about the sort of data that's needed and of interest. So we are really open to furthering the role of creative arts in health. The Albanese government is a partner really wanting to work with you on that. So thank you for what you're doing, and I'm really looking forward to hearing some of the ideas and thoughts that come up today about how we further that.
So thank you again. Thank you so much, Susan. It's really fabulous to have you with us, and to indeed, I think people will be really looking forward to that part of the conversation. I'm noticing a great theme of the importance of evidence in supporting policy development across both those presentations. And perhaps that too will be something that you would like to comment on. Associate Professor J.R. Baker, really pleased to welcome you now for your reflections. Associate Professor Baker is the chair of ASPIRE, the Australian Social Prescribing Institute for Research and Education. Now, ASPIRE, in a way, is the expression of 20 years of work, dedicated work and commitment around primary and community care. And Associate Professor Baker is Chief Executive Officer of Primary and Community Care Services Limited, as well as an Adjunct Associate Professor in the Faculty of Health at Southern Cross University. He's had over 20 years experience in health service planning, commissioning, management, education and research, consistently introducing industry-leading service improvements that keep the client at the centre of change, and pushing primary and community care services to become an Australian leader in social prescribing, complex care coordination and link work services, and has lots of experience actually in delivering social prescribing services particularly across southern Queensland. For a long time, we talked about social prescribing as being on the way, but I feel like it's really here now. Social prescribing goes beyond only, it's not only about arts, but we'd be really looking forward to hearing your perspective about how this allows us to address the needs of our clients and communities.
Thank you very much. Yes, I think social prescribing for people who are not familiar with the concept is really looking at what complete well-being looks like for a person. So the healthcare system tends to just by default look at what's not right for someone, symptoms and suffering and pain, and tries to adjust some of those things. But it doesn't tend to start at the building blocks of good health, everything from food security to belonging to purpose to meaning. And in a similar theme, and I go off script a little bit too much, so I will do so already, but you know, art has become so pervasive in so many areas, but not always with the depth and engagement we used to have. So we're used to streaming movies on demand, just as an example, and movies were a very special thing 100 years ago. Photography on an iPhone is very simple and technologically possible, but in the 1860s, I can't imagine developing an early photograph. So because we have access to things that are so producible in such beautiful ways and so theoretically, plastically perfect, I think sometimes the imperfect beauty of art, the pre-singing before auto-tune existed, that whole side of things has sometimes been forgotten. But not for long, I suppose. So social prescribing really is about connecting people to all the things that make up well-being for a person. And arts on prescription in particular has a long history, even before it was called that, because it's been done a long time before social prescribing was coined. I think if we treated art the same way as we treated drugs, just because prescription is in the name of the title for us, we'd fund it quite differently. We know that art does great things. Just from the previous two speakers, everything from managing stress and actually resetting your mood, through to reducing aggression in aged care facilities and increasing multisensorial activation, and ultimately great things like staving off dementia, reducing loneliness, things that are actually very expensive health costs in the grand scheme of things if we look from a preventative perspective ahead. We know that loneliness is linked to increased cardiovascular events on top of dementia. And if we actually, since we talked about measurement and value, just to jump quickly to it, since it was an invited sort of comment area, I don't think the way we value things usually captures things accurate true value. So doing an RCT for arts or for anything in social prescribing, whether you're comparing if someone wants arts or food security, I don't think that's always the most effective way to see if something adds true value. True value is probably better captured by acceptable sort of models like value of statistical life years, where you look at what if I could get back 2 extra years, how much would I pay for it? Any health economist here might kill me for summarizing it so simply and not quite accurately, but the gist is right. And so with dementia, what would it be worth to you to get 2 years of life back without dementia, to have better health span and longevity at the same time? But also, what would it look like for your friends or family who care for you during those periods and who also have that loss of statistical value of life effectively? So I think to not value art in particular and its long-term preventative sort of perspective is a huge risk, a huge social risk. So where is it now? I think there's great examples from the previous two speakers in that PHN space. There is also under the preventative healthcare plan and the primary healthcare plan from the Commonwealth Department of Health, places for social prescribing to be used within primary care to address health needs, but also preventatively. It sits as well within the increasing number of inquiries into social isolation, loneliness, and mental health across most of our states and territories. So at the minute, Aspire is doing some work with the Queensland government in a pilot of social prescribing for children and young people. And arts on prescription is one of the things that keeps coming up. And that gave me some pause before coming here today to think about where art touches us across our lifespan. And And I think probably until 8 years of age, we can get away with a lot, like any music we'd like to do, to listen to and make art how we'd like. At a certain point, we seem to move into a socially more cohesive and less personally expressive sort of life stage, which involves at some point work and possibly parenting pressures and all sorts of other things. And then at the end of life, we see art comes back often. So a lot of the aged care facilities and even the sort of home packages people are receiving now with changes to our aged care legislation, I'm seeing art a lot more in those sort of settings. My parents are very lucky to have picked a place to retire that has an art studio in it, and also lawn bowls for dad, but mostly the art studio. Mum's been an artist her whole life and was an art teacher and used that in other contexts to also improve health through indirect pathways. So using art to improve education and literacy across all subjects. She used it to teach everything from astrophysics through to healthy eating, which is interesting. And so I think whilst there's probably an opportunity to talk about very specific sort of value points and interventions, art ultimately has an impossible to separate link to well-being, I suppose. It portrays what health is and actually communicates to people, whether or not they have the language to understand. And inversely, they can communicate through art what's actually happening to them with different language formats. It's generally much more culture-free, and true art lets you challenge social norms and recreate social capital and wealth. And so while we're talking probably more about physical health today, I think civic health, a place, a community, a society where we value expression of different opinions, where we actually move beyond beauty to focus on meaning, where people can be valued for their contributions at any age and with any background. It's a wonderful thing. So I suppose just to share one art reflection from a social prescribing journey, the New South Wales government workers' compensation scheme, iCare, funded a social prescribing trial a few years back, and it was very art focused. We did the social return on investment figures and some general ROI figures and found various values between $3.84 and $5.60, depending what you were costing into it, but quite good returns. But I think the most interesting thing for me was many of the artists were in, severe and enduring pain. A lot of the people had been off work for many years. And the way they described how art let them separate out from their illness and actually to be identified as an artist or to have that time to think about something other than nominating treating doctors and rehab and surgery. The space it opens up for us to be creative, to be connected, to be ourselves and to be whole is hard to value. And one person I'm thinking in particular, she went off after doing art for 10 weeks to go study a master's of fine arts and is an art teacher now. So little things make big differences. And so that difference will cascade to hundreds of students and then thousands of people. And that sort of that effect when it cascades is very difficult to measure. So the value is often lost because it's not a simple give person drug A, see what happens over 12 months, and then estimate cost of funding drug A for the next 52 years. But on the flip side, art can be generative. And so my one takeaway, and I'll probably stop at that one from delivering arts on prescription programs, I've noticed the best outcomes tend to come from actually valuing artists for their artistry, for their professional conduct, their knowledge, their skills, and for them to actually share their passion, their values, and their technical knowledge, and to actually so generously give that. People receive that gift quite well, and they take that gift and they share it as well. And so I think art is a wonderful sort of broad range of disciplines, really, because you can see anything from music to comedy to visual arts to poetry fall into that spectrum, but all of it adds meaning and value to our life, and we all can give it freely to others. So in terms of creating access and equity, social prescribing has a wonderful sort of place in the new way of things to help connect people to things they might not be able to access or afford, to make sure they feel safe and comfortable to get to those things, to make sure they feel they fit in and can engage fully, and then to really focus on all the things that can be improved, whether it's relief and mental health, whether it's physical well-being, whether it's improved social connections, or whether it's actually feeling like what you do matters for the first time and having people value you just for being you. All of it is immeasurably important. But I'll just stop there so we catch up to time, and then I'm happy to take any questions later. Thank you.
Thank you so much, Associate Professor Baker. And you were very eloquent about how all of those things do come together. And I think sometimes some words provoke particular reactions. So some of us do, well, some people have had a particular reaction to the word prescribing and the sort of resonances that it has. But you've spoken to us as somebody would who is centered in primary and community care, where that holism is so central to practice and brought that so visibly before. So thank you for that. And I think, you know, that we have this spectrum here. We started with a state set of policies that are located first in hospitals, and then thinking about how artists come into health service contexts, and then how health service contexts might open up and be repurposed in ways that allow us to connect. And then we've got these two pictures of a quite holistic vision for how we might explore the space nationally, one through the on-the-ground primary and community care, and the other through the big architecture of cultural policy. Kerri, I'm so pleased to have you provide us with a reflection now. It's a huge pleasure to me to welcome Kerri Glasscock, CEO, Sydney Fringe Festival. And I don't know if you're going to sleep or take a deep breath before becoming the Executive Director of Create New South Wales. Kerri's a well-known and influential arts leader in Sydney, having built a strong reputation as a practitioner, an independent theatre maker, award-winning venue owner, artistic director, CEO, and an advocate. And many of us here are advocates and want to learn how to do that better. I have a really long bio to read about how amazing Kerri is and how much impact she delivers, but I actually rather listen to what you have to say. So can I invite you to provide a reflection on what you've heard tonight?
Yes, absolutely. Thank you so much, Claire. And I'm so grateful to have been included in this discussion. I'm zooming in from Gadigal land in the inner west of Sydney here. And I apologise for any background noise. Completely on point, there is a brass band performing downstairs at Fringe HQ here tonight. So let me know if it gets too wild. It's been so great to hear tonight firsthand from so many of the leaders in this space, and especially ahead of me embarking on my new role, to be able to connect with so many of you, because certainly one of my key priorities going into Create is going to be around strengthening and building cross-government partnerships to make sure that we're placing culture at the heart of New South Wales. Brigitte, I'm so looking forward to becoming a colleague of yours, especially after hearing some of the amazing things that you are working on. And Susan, you'll be pleased to know that I'm a diehard Meatloaf fan. And as a Central West born and raised girl, I have driven that Great Western Highway singing Meatloaf at the top of my lungs on many occasions. My background is in activating and advocating, and tonight I'm going to be coming from that lens in my reflections and put a few ideas on the table. Sydney Fringe is unique to other arts organisations in that we're an open access arts festival, which means it's about democratised participation. Anyone can take part. And because of that, we're able to build a data set each year that is a snapshot of everybody and anyone who takes part in the festival. And we work with 2,500 artists a year, from very first time performers through to global award-winning touring companies. And this has given us a really strong idea of needs, which is where we've built our advocacy, success and platform from. And I had the great pleasure of being one of Minister Burke's advisors in the creation of Revive and also in the creation of Creative Communities, our New South Wales policy. I think for me, one of the things that sparked from listening to those presentations is really the idea around ground up, community-led and authentically community integrated activity is really the ideal scenario if we're looking about providing equitable access to our citizens, wherever that is across our communities. And it's an interesting question for me as someone from the sector around what sort of activities are considered as supporting health benefits, because certainly we know, and we've heard from a couple of our speakers tonight, that culture is essential to community well-being and belonging much more broadly. And I think there's a real opportunity for government departments outside of traditional arts and cultural agencies to play a role in that equitable access of space. And key to the provision of culture, particularly in New South Wales, and that's the lens I speak from, space is of a premium, right? It's about access to facilities. And I've been a long time and very vocal advocate of not only the readaptive use of space, but the provision of cultural infrastructure in all major infrastructure projects. And it's one thing that I'd love to put on the table here, because for me, if community appropriate space was considered from planning phases in health infrastructure, but indeed in transport or education, then we would definitely be well ahead of where we are in terms of equitable access. And key for me in contemplating this is the definition of what are those needs and what really is cultural infrastructure. It was great to hear about Brigitte's readaptive use. I think sometimes it can be overwhelming, the idea of embedding cultural activity. People think they need a massive theatre, but really a cultural space can be a small space with a sink and some power. And it would be fantastic if we could start matching local community needs with potential infrastructure developments to aid that building of local partnerships. I think that's a really interesting idea. The New South Wales government's creative communities policy, which I will now have the privilege of implementing, certainly embraces the role that government is the creative sector's key advocate, enabler, and investor. And it commits the policy as an all of government activity. So it's so great to have this conversation around health. I think one of the most powerful tools in that is that there is a triennial creative statement to Parliament that has now been legislated. And so this is going to ensure that our government and future governments will need to report back on policy implementation, on progress and impact. And this provides a really powerful impetus for departments like health to reimagine how they might interact with the sector, because there is an avenue and a lever now to be accountable for providing those tangible support frameworks for artists. One thing that I thought might be interesting to throw down today, Claire, is the idea around transferable skills. I was so glad to see Brigitte touch on potential workforce development, because one of the things we saw in our community during the pandemic was an immense amount of creative sector workers, such as production managers, producers, site managers, etc., taking on really significant delivery roles within health as the rollout was happening, because the skill sets are so aligned. And one of the really interesting things to think about in that side of things is that many artists and creatives work in those areas as well as practicing their art. And so I think there's a real opportunity to consider kind of, in inverted commas, day job style employment as well within government departments that utilise incredible skill sets that the sector has, but also would provide regular employment to create by default creative practice that then has all those other impacts across it. And I just wanted to pick up finally on the data piece that has come up with everybody. Certainly from our perspective at Fringe, data is everything, and all the work we've done in sector, data-driven policy development is vital. And for us, our preference is that that should be led by sector, and it should come from on the ground work with real-time impact analysis. So it was wonderful to hear about the Revive pilots from Susan. I'm going to keep a close eye on those. Where we've seen this work best is when government supports pilot project trials that tackle a sector need and a government priority or a regulatory roadblock at the same time, where the benefits are aligned and the impact can go across multiple sectors. And just to the kind of demonstrating kind of value piece, the sector's definitely not good at demonstrating this yet. At the other value pieces, we have by default and by the frameworks that we operate in, been very focused over the last couple of decades on our economic impact. And these have been KPIs that have been set by government to our sector, but they're really there's not a consistent framework that's readily available across the whole gamut of the sector, from the very small to the very large, to be able to assess that social well-being, the impact that we have on all the other aspects of life. So I think there's a real role for government, universities and other agencies to play in this space around setting up a framework that is accessible. So not only sharing the impact of your own projects, but providing sector the ability to utilise some of those frameworks so that they then can demonstrate and connect into your projects in a better way. I'm mindful of time, but I could go on all night, but I'll leave it there, Claire.
Thank you so much. They were extremely, I want to say, on the money comments, extremely relevant comments that chime with the things that I think we hear at Sector Leadership. Everybody, now is an opportunity to put your questions. Can you ask them in the chat? You can write them down in the Q&A in the chat function, and we'll read them out. And while you're getting ready to jump on in there and add your questions, I might just start off with a simple one, which is to say that for when we started the Arts Health Network New South Wales, for a bunch of people who were, many of us were practitioners on the ground. Some of us were just interested. We didn't really know what policy was, and we didn't know how to place ourselves in relation to it. It seems like a black box. It's amazing to have access to you speakers tonight. So if I am a person who has a great idea for an arts activity that I think is going to make a real difference to the well-being of some group of people, where do I start? And what's the advice you would want me to carry with me, particularly in relation to identifying the value of what I do? And any panelist can jump up here and say, here's how you can feel like you know where to go first. And come join the network. That's one thing you can do, and we'll advise you as best we can.
I'll just start with an observation. When people ask me about that, and I have incredible creative people in my community and those who come to me from outside, I say primary health networks are a good place to start a conversation, because nearly all the federal funding for mental health, community mental health stuff from the federal government ends up with primary health networks. They also have some state funding, but they're primarily federal funding. And particularly where we've had disasters in my community, a lot of the recovery and trauma recovery funding has been channeled through there. And so that is one pathway where I encourage people to have a conversation to see what is already available and identify where it might fit. There does need to sometimes be creativity in matching it to the funding, things that are available. But then what happens is the demand feeds up, so that if there's not something that's available, that then starts to be talked about at the bureaucratic side, and then on our side as the elected representative side. So that, for me, that's a really practical starting point. And I can only speak for my primary health network, Wentworth Health, covering Penrith, Hawkesbury, Blue Mountains and Lithgow, that they're always open to conversations on a new approach, because their job is to make decisions locally for the health benefit of the local communities.
Susan, would you say that people can or should go and speak to their local member to ask where to start?
Oh, and always talk to your local MP, connect with them. There'll always be a range of responses in terms of their level of understanding and their level of interest in health or arts. But one of my jobs as Special Envoy for the Arts is to encourage the caucus to appreciate the role that arts and creativity has, not just if someone's a painter and they're coming to you to get support for an exhibition, but to think about it across every portfolio area, including health. So yeah, absolutely speak to your local member. And I would say speak to your state member as well, because I think the next step really is New South Wales has a whole lot of pathways that are worth exploring.
Brigitte or Kerri, would you also like to say, what should someone do when they don't know where to start?
I'm going to throw that one to Brigitte.
It is a really good question. I think Susan's answer to it is actually exceptional. I might take that up myself. The go-to for us at New South Wales Health would certainly be the Agency for Clinical Innovation website, and I'm going to shortly put that link in the chat, because that gives you a broad brush picture of the different types and experiences, research activities, etc., across New South Wales Health. I certainly would encourage you to reach out to Claire and to Katherine if you are New South Wales based. I don't have any problem with our HArts email address also shared, which I'll put in the chat, but I'm not going to be able to necessarily connect you across Australia outside those jurisdictional representatives that I've got through the AHNNA network. But I'm certainly happy to try.
Brigitte, someone's asked, is there a place for volunteers going into health or care facilities to, for example, facilitate writing group, journaling and so on?
Yes.
And so I guess there's a short answer of yes, and maybe you might expand on that briefly, but maybe we might also say that you need to enter these spaces with care and with some training. And the training ranges from understanding infection control protocols through to understanding elements of good practice in care, like trauma-informed care. Do you want to expand on that, Brigitte? It's a great question.
It's an excellent, really great question. Yes is the short answer. And different health services will have different capacities to be able to support that training or not. The question that I'm sure Claire will pose to us shortly is around equity. It's fascinating to myself and team at Health Infrastructure. We have such a huge interest in these projects rurally and regionally across New South Wales. Much stronger appetite rurally and regionally than we do in metro services. I'm really proud that some of our rural and regional services are in fact providing a guiding light how metro services can do it better. But on that front, there are some really exceptional programs like the artery program at Royal Prince Alfred Hospital through Sydney Local Health District. They do have an active program. I'm very proud that there are a number of artists online tonight that have been either a part of that program or working within it. There are also services like the Sydney Children's Hospital Network. Ivy Baddock is amazing in this space, the curator at the Westmead service there. And I know that there's a number of different avenues that we've got potential for to connect people in with that different training. It's not always going to be particularly consistent in your local health area, depending on where you are, but certainly the new New South Wales Health and the Arts Framework has a very specific focus on trying to improve the equity of access to these services. So whilst it might look patchy now, hopefully in 2030 and beyond, it's got a much more consistent base to draw from. I think the work that Susan's team at Creative Australia are working on at the moment, Susan mentioned that the policy work that Dr. Kristen Cornell is working on, also really great work that will hopefully also build the potential for a scalable training model for practitioners in this space to access. So it's not just about art therapy, which is obviously a broad and very well recognised training, so to music therapy or dance therapy, bibliotherapy, but a more non-clinically requiring service that it's not one-to-one and that can be more self-directed as well if supported. So it's coming, I promise.
Thank you, Brigitte. One for you, Associate Professor Baker. Someone would like to know, what's the extent of link workers now in Australia? What's the kind of landscape for social prescribing?
Yeah, sure. So interestingly, a lot of the link workers across Australia are attached to primary health networks in some way. So within the preventative health, my God, the 10-year preventative health plan. Sorry, I'm not usually used to speaking when I have a cold, so everything I say feels like it's out of sweats today. But I'm holding it together pretty well, I think. So, a lot of the PHNs are delivering social prescribing things nationally. They don't have to, and they do it different ways. But certainly, people are accessing arts and prescription. I know in Southeast New South Wales through Coordinator, Nepean Blue Mountains, Northern Sydney through some of the mental health step care programs. In the Gold Coast, there's a mixture. So there's some actual outdoor art in the park, beautiful stuff, as well as poet expression doing Shinrin Yoku, so forced bathing. So there's sort of combined functional activities where people get direct health benefits, develop skills, and apply them. But I guess also touching on the other earlier question about where somewhat, I guess, funding sits and how you can actually get projects or programs up. There is funding everywhere in some regards. So certainly lots of different aged care providers, NGOs, and even for-profit private entities are pushing for arts. The disability sector with the NDIS, although things change over time, some of the organizations are at least using participation funding to organize transport and activation. Within even education, obviously, things that lead to longer sort of whole life health risks, like school refusal or communication differences and difficulties. Arts have been used in various programs to actually bridge those things, and there's been funding available. And from a voluntary perspective, I think, most of the not-for-profit community managed orgs I work with usually are crying out for people to help and to actually build things that make a meaningful difference for people. And most recently, I've noticed social prescribing in the UK and in Singapore and other jurisdictions has also been increasingly hospital-based. So in Singapore, I was at Sing Health maybe 3 weeks ago. They were using arts to do fine motor skills with some detailed sort of painting techniques, but they were also looking at aesthetics of garden presentations as an occupational therapy rehab sort of exercise. So there's a lot of places that things intersect. And even the culinary arts with sort of multi-sensorial sort of presentations of food with cloches and smoke flying everywhere. There's theater and drama to stuff now. So I think how we can embed it is as creative as a bunch of creative people can be. So the endless possibilities in that side of things. Less thought of things, I guess, might be around some of the larger health literacy stuff. I remember UNSW's, it's not COFA anymore, art and design faculty, whatever the appropriate language is now, certainly was talking about using art as a form of public engagement and expression to actually understand what's actually happening and what are important sort of facts and how to manage their own behaviors and activities and those sorts of things. So, but back to the original link worker question, which I only half answered, apologies. Certainly PHNs are a great point of contact, but there's also neighborhood centers, more so neighborhood houses in Victoria, where there's 400 and something of them, or community centers in Queensland. So all the sort of peak bodies in each of the states and territories would have access to those institutions, which do have some classes or courses. And then sometimes academics are happy to try to support getting those sort of activities up as well. Certainly people involved here today, and another example specifically social prescribing out of South Australia, just to give some broader national coverage. The Pinaroo project had over 80 professional artists come and do micro workshops and share their skills and abilities with community members, and activated everyone from farmers doing welding through to painting on water tanks. So there's a lot of possibilities. They had a decent ROI. They actually saw improvements in smoking behaviors and diet attached to art, which is fantastic. And I think the return was closer to the $2.50 for every dollar invested. But I mean, it's all a bonus because it's beautiful. People had a bunch of skills, and there's better social cohesion and connection than there ever was. So anywhere and everywhere, but it's increasingly getting funding through primary health networks, through various state programs, and being introduced increasingly across largely preventative health plans and plans around social health and well-being and civic health. But hoping to see those sorts of things embed into more sort of national, very health focused plans as we go forward.
We have just a couple. I really want to get to the sort of community and equal access questions, but just from the chat, if anyone would very briefly like to address two more sort of health services focused questions. One is, who's responsible for the development of clinical indicators for measurement? So Brigitte, that does rather sound like your territory, perhaps yours also, Professor Baker. And can anyone comment on the engagement of private health sector in this space? Both of them might fall more to you, Brigitte. I've lost your face actually in the sea of
I'm
video.
here. I'm trying to think of a succinct answer. I think in two parts. One is there are different activities that have different measurables. And so it can be very specific to the clinical area that you're looking at. The other context is in the models of care as part of the new framework and it being anchored within the Agency for Clinical Innovation and the Clinical Innovation and Research Division of New South Wales Health. The opportunity to develop models of care for arts in healthcare, primary healthcare, wherever it might be, is being very strongly looked at. And as part of that, the measurables to address that question would be paramount. It wouldn't be a quick fix, but it's certainly a very important milestone that we look forward to meeting within the next couple of years.
I have a question just tied to that as well, just thinking about the whole impact question and measurement, etc. And I'm wondering, I'm not sure, JR, if you have any information about this, but the Elemental platform that's used for social prescribing in the UK, whether that's something that Aspire has thought about, or would that be useful in this case? I'm not quite sure. I don't know too much about it. I know I investigated it some years ago, but just wondering if you could comment on that.
Yeah, so having common places to collect data, like a platform like Elemental, I think it's been resold 2 or 3 times through sort of different arrangements. But the idea was great, which is you identify people with unmet needs. You can actually track pre and post data, whether it's just general questions on well-being, or whether it's things like health-related quality of life brief scales like the EQ5D5L. Whatever it is, there's enough data points across enough people that you get a sense of changes in well-being over time. Things that you can turn into dollars and cents are always helpful. So health-related quality of life is something you can usually index. So you can kind of flip into a decrement sort of version where 0 or less than 0 is death or worse than death, and 1 is perfect health. And you can measure the changes people get and then actually add value to those, because you're looking at adjustments and different things, so qualities or well-beings or whatever you're working through. So there are ways to value the interventions when you get pre and post data. I said interventions, though. This is where it gets a bit sorry to do that to you, because art is also beauty, and I'm super biased in that sense. So there are options around valuing referrals into these sorts of programs. And you know, in Canada, I saw some COPD choirs. So looking at specific health conditions, you can and certainly pair a treatment, which isn't have to be a treatment, with a physical health condition. Where things get a bit funny, and what would be a great thing is, just even from a research perspective, is if there was a bit more overlap between research funding streams. So NHMRC funding often doesn't love to deal with non-medical things, and ARC funding often doesn't love to deal with medical things very specifically. And that applies to most of the arts on prescription. Sports on prescription, people sometimes let through a bit easier, but that's because physical activity and health have a more obvious sort of link, because people think blood pressure and heart rate, but they're missing the part where you can actually reduce those things at the same time by actually doing something meaningful and peaceful and socially. And so I think for such a long time, we focused so much on medical research being really quick, reactive things you can measure. we don't tend to look as much at these sort of less tangible things in terms of longer term epidemiological studies. But one of my colleagues, Roseanne Freak-Pauli at Monash, has been looking both at dementia and all causes of cardiovascular disease, and found things like doing a social activity with friends where you're doing painting or drawing or whatever, or playing cards, even for what it's worth, can reduce your CVD risk by 20-30% on its own. So if we actually gave everyone a paintbrush and a palette and paints and whatever else, and I'm just picking that as an example, and I think most people would be very happy to have that as expenditure out of our tax money, as opposed to paying for hospitalizations, losing 3 years of functional well-being for someone, or developing dementia early. So I think that sort of longer term, either epidemiological research or where we actually accurately value the amazing value of these sort of approaches to well-being, that has to be what happens next. But it'd be great if we could kind of combine the funding approaches, so it makes it easier for academics to work collaboratively to actually just put the clear case down, and so we can get on with being well and healthy, connected, and creative.
Woohoo! Yeah. We're going to take it as a mission statement. Already time grows short, but I'm going to guess that I'm not going to be the only person who, on the one hand, loves to hear these exciting opportunities and the confidence that you as policy actors show that we can powerfully address and make change in their fields. But then there are these little moments where it feels dominated by the norms and discourses of policy actors and health people. And I start to long for just being in the magic of something that happens in arts in the community. JR is nodding. Kerri, I'm assuming you are only too familiar with walking and across these it's almost like being two-spirited or something. How can we be good advocates, and how can we be great advocates so that the faces that we see in the hospital waiting room where you're writing about you're doing life writing in palliative care, or you're doing painting in cancer care, so that they're not only white and female? Just a couple of little questions in the last few minutes, Kerri.
Okay, super quick thoughts. And there's a crescendo downstairs, so if it gets too much, just let me know. The two things there. I'll go back to in relation to diversity, I'll go back to my earlier point around really authentically embedding into community. And I think this is the key. We have to find ways where we can connect and build partnerships in facilities with local community and with a diverse mix of community members and providers. And this goes to my dream, but also evidence base of where the most success comes in the advocacy space, which is where you identify a sector or community need and an industry or department need or facility need, and you marry the two of those things. That's always been where I've seen the most success come from in the advocacy. You find a problem that needs to be solved, and you pair that with another ambition from another part of industry or government or sector, and that's where your magic happens. Yeah.
Thank you. That's a really useful observation. I think it's really helpful for guiding everybody. I'm just going to quickly ask each member of our panelists to say, what is a policy action that you think that we can aim for over the short to medium term, over the next year or two, that the sector can help you to achieve, or that the sector can work towards? Kerri, do you want to go first maybe, and we'll go in reverse order?
I'm so sorry. I was very distracted then by the trumpets. So
we can't hear them. It's only you that
it is a lot. Yeah, you'll have to ask me that question again.
Well, let me ask everybody else, and you can let the trumpets blare, but safe in the knowledge that they're not blaring for us. So I might go in reverse order. Associate Professor Baker, what's something that we can really feel like we could work towards actually achieving over the next year or two, or help you to achieve?
Just one thing. All right. It's always interesting because I just have to be parsimonious. What is the simplest thing? It'd be nice to see an overt active sort of to push for an overt active funding somewhere. So whether it's through PHNs because it's a Commonwealth mechanism, but to look at something that very clearly overlaps. Or even if it was just for every Aboriginal controlled health organization to actually give specific funding for a cultural wellbeing worker there as well, not an Aboriginal health worker because it's got health in the title again. But I know up the road from where I am now, Eleanor Duncan, Aboriginal Medical Service in the Central Coast, they do lots of connection to culture and art and country and music activities. And those things are essential part of well-being, and there's a bit more flexibility there, but I'd love to see that sort of model scaled up for everybody so that we actually can all get access to connecting with our own cultures, but with other cultures, and to actually look at that synergistic sort of approach to global cohesion across Australia through mutual appreciation and put money actually to support the connection of the bits and pieces. Otherwise, I just say national outcomes framework for arts and health would be probably clean based on what everyone just discussed today.
Well, I feel like, Susan, the pressure is on then. Even a small amount of funding at the primary health network level would probably create that little tiny bit of capacity, even just for people to have the conversations. And then JR's put a little agenda before you. What are our chances of moving ahead with it? And what can we do to help it happen?
Well, I think this is the ideal time to be doing it. And what RJ just said then, I was listening to the law report today, and I'd encourage people to listen to it. It was on The Torch in Victoria, which takes art into prisons for Indigenous inmates. And the quote that stuck with me was one of the people involved saying, "Art and culture practice heals." And you couldn't put it more plainly than that. So the opportunity that we have is that next year, at probably fairly early in the year, we'll start all the policy development for the next iteration of Revive, so the next cultural policy. And I think there wasn't time for the first one. For a lot of the discussion, we're having to really be more addressed in a more detailed way. But I do think this is something as a sector it'll be really important. Now is the time to be doing it, is to be putting together ideas and practical policy suggestions. I've already, while we've been talking, messaged my arts advisor who's on this call and said, oh, we need to talk to the ministers about the NHMRC and the ARC grants, because I'd never thought about that, that neither of them quite do it. So, you know, that's something that I'll take out of this discussion. But Revive, the next iteration, that now's the time to do the work, get things to me, to the minister, to the health minister, the assistant minister for mental health, the aged care minister, like all of that stuff should be going, being, you know, really, I'd encourage you to flood our offices with those great ideas, because now's the time to be thinking about it.
Awesome.
And an exciting time.
It's an exciting time. I'll remind everybody, August 27, we'll be coming together to spend the whole day to think about where we can do some policy building, and you've given us a great invitation for making that ready to support the next iteration of Revive. Brigitte, how can we help the development of arts and health in New South Wales?
One thing only, and I'll be certainly calling Kerri when she starts next week to see what we can do to amplify it. And that is to embed a dedicated arts work, exactly as JR said, to scale up. So we need someone like what JR was talking about at Central Coast. We need that at the system level, and that one dedicated person to then be able to map it at a system level and implement activities. It can't be great governance and all the rest of it, but it not actually have a dedicated person to drive it forward. You do need someone on the ground to drive it forward. And I think all the rest can happen if you've got that. But if you're relying on it being someone's role, you know, as part of small thing that they're already tasked with doing, it is just insurmountable to do on their own. It has to be a dedicated officer driving that inside health.
Kerri, time for your reflection. And I must say, if you'd like to add to that a thought about how none of this happens without artists.
Yeah, one thing I was just thinking about then is how foreign I would imagine a lot of this is to the broad part of the sector. And I think there's an opportunity there for some sort of uniformed platform where information is brought together so that sector can actually access opportunities that do exist, but also, you know, where we can have a kind of database and a connective piece of connecting sector to whether it health, I mean, it could go across lots of departments, but let's say health, right across the country. I'd love to see also a pilot, I'm putting it back out there, but some sort of pilot program around this transferable skills piece, because I think there's something in that that's a bit of a win-win for both sectors. Yeah, I think those are my big ones.
Thank you so much. All right. Well, we've got a lot of work to do together. I'm just going to share this while I say my thank you to everybody, because it gives you those QR codes up again. One to the Create Centre, one to the Create Centre YouTube channel where the video of this meeting will come up, one to the Arts Health Network New South Wales ACT. You can become a member in two ways of the network. You can simply subscribe to get updates from the mailing list, or just follow our socials. You can similarly join the mailing list for the Create Centre. That's also true for the organisations of so many people who do amazing work represented here tonight. So have a look at Sphere in the Know and the Knowledge Translation Program that Katherine leads at Black Dog Institute, at the Big Anxiety Research Centre at New South Wales, at Aspire, where there's a wealth of information and no doubt a conference on the horizon. It's wonderful. It's really supportive. People find their people there. And that's only scratching the surface of the many activities that are being undertaken around the country and on the ground. Thank you so much to everybody for coming tonight, for being part of the conversation. Thank you so much to the Create Centre and to the wonderful Anna Camerali, who has been a mastermind in making this video happen and managing the registrations and all that practical work in the background. Huge shout out to Martha Waugh, who is the Arts and Health Network Secretary. Similarly, that person who is actually making the magic happen in the background and doing a lot of the nuts and bolts without which none of this would be possible. And such a deep appreciation for all four of our panelists for joining us tonight and giving your time in the evening and amidst impossibly busy, exhausting professional lives. It's so amazing to hear from people in policy about what you need and how what we can do can help address those needs. It gives us direction and it gives us hope, and it gives us a real sense of being in community with you. And we couldn't be more grateful. So thank you to everybody. And hopefully we'll see you again, perhaps on August 27th or on other times as we carry these conversations forward.